Hello everyone! Thank you for the chance that given to our group. Before we start, let's introduce ourselves. I am Tia Rohana as moderator and role-play actor.
I am Anissa Rizka as the first speaker. I am Iskia as the second speaker. And I'm Mutiara Putri as a role-play actor.
In this presentation, we are going to discuss questioning to fill pain assessment form.
Okay, before we go into the material, we want to give some quiz. And these are the questions. 1. What is the meaning of R in PQRST? Please describe it. Number 2. What the meaning of squeezing? And the last, number 3, how to inquire about the time or frequency of the patient's pain. Yes, you can answer it in comments column. To answer correctly, let's look at the material first.
Okay, I will ask little about this material. What do you know about pain assessment form? Then what are the things that must be considered pain assessment? Alright, the pain assessment form is a form contains pages of information about client, including the location, types, frequency, and intensity of pain. Next, we switch the vocabulary. The following vocabulary will be discussed. Firstly, when we are going to do pain assessment, we will be faced with adjectives that are used to describe a patient's pain. In the following example, Number 1. Stabbing, nyeri seperti tertusuk. This pain is common in people with asthma, which when it recurs will cause pain in the chest. Number 2. Numb, seperti mati rasa. This pain is common in people with diabetes mellitus. Number 3. Draining, menjadi tak berdaya. This pain is common in people with fever. Number 4. Burning, rasa seperti terbakar. This pain common is burn sufferers. Number 5. Squeezing, rasa sakit seperti diremas-remas. This pain is common is people with dysmenorrhea.
Secondly, I will explain about pain assessment. The following is an example of pain assessment form, which includes personal data on the form, such as name of the patient, diagnosis, date, age, room, and also the result of pain assessment. Okay, show the example of pain assessment form. Here, we can ask the patient a few things to see the condition. The first to ask about the current pain medication. Example, did you take any medicine or anything for it or for your pain? How many do you take? We can use PQRST method to do that. Did you know what PQRST method is? Yes, the PQRST method is a method used to assess a pain. This method consists of provocation and palliation, quality and quantity, region and radiation, severity scale, and time. Here, I will explain more detailed about the PQRST method. 1. Provocation and palliation. The nurse examines the causes or pain stimuli of the client. In this case, the nurse can also observe the parts of the body that are injured. To ask this information, we can ask the patient this way. 1. Do you know the cause of your pain? 2. Why do you feel that? 2. Quality and quantity. The quality of pain is something subjective expressed by the patient. Usually, the patient describes pain with sharp, dull, throbbing, moving words such as being crushed, stinging, stabbing, etc. Whereas the quantity shows how much pain you feel. To ask the quality and quantity of the pain, we can say, what is the pain like? It is sharp, during, stabbing. 3. Region and radiation. Region has something to do with the location of pain. The nurse asks the patient to show all the areas the patient feels uncomfortable with, while radiation to find out whether the pain spreads to other areas or not. To gain the information about them, we can express, show me where the pain is, point at the pain you feel. 4. Severity scale.
The patient severity of pain is the most subjective characteristic. In this assessment, the client is asked to describe the pain as a mild pain, moderate pain, or severe. Example, on a scale of 0 to 5, 5 being the worst, how would you rate what you feel right now? Not. Number 1 is no pain, 2 mild pain, or gnawing, pinching, tight pinching. 3. Discomforting pain, or troublesome, nausing, pressing, numb, and crawling. 4. Distressing pain, or measurable, agonizing, gnawing, draining, and crawl. 5. Horrible pain, or intense, fearful, cramping, squeezing, and vicious. And the last 6. Excruciating pain, or unbearable, loathing, crushing, tearing, and killing. The last information that we ask in pain assessment is time. To gain this information, the nurse usually asks about the onset, duration, and the cause of pain. For example, when did the pain start? How long has the pain been felt? Is the pain felt at the same time every day? How often do you feel the pain? The first, to ask the current pain medication. Example, number 1, did you take or any medicine or anything for it or for your pain? 2. How many do you take?
Okay, now we will show you the role play about questioning to fill pain assessment form. In this role play, you'll see Tia Rohana as the patient and Mutiara as the nurse.
A patient named Tia, 19 years old, has been hospitalized since last night. She complained of chest pain, stomach pain, unknown cause, with a pain scale of 3. Pain sometimes appears. Pain occurs during activity and disappears when resting. Good morning.
Morning, nurse.
I am Tiara. I am the nurse on duty today. Who am I talking to?
I am Tia.
Hello, Miss Tia. How are you today?
I feel pain in my body.
Okay, Miss Tia, I need to fill in a medical report about your health status. You can tell me all about the pain you suffer.
Sure.
Please show me where the pain is.
It's around here.
What is the pain like?
It's a stabbing pain.
Do you know the cause of your pain?
I don't know why I have pain in my chest.
Okay, on a scale of 1 to 5, with 5 being worse, what is the value of your pain?
3, I think.
Okay, how often do you feel the pain?
Sometimes I feel the pain.
What is makes pain better?
When I rest, the pain will disappear.
What is make pain worse?
Usually, when I do a lot of activities, the pain will worsen.
Any associated symptoms?
Nothing, nurse.
Okay, Miss Tia, I will report your condition to Dr. Alfian and we will give you something to make you better. I will report to Dr. Alfian.
Okay, nurse.
Okay, Miss Tia, excuse me, see you again and hopefully it will get better soon.
Thank you, nurse. See you.
That was the roleplay how to do pain assessment by asking the need information to patient. Can you do that on your own to your patient? Yes, of course you can. Okay, after seeing the material, we can answer the quiz that was given at the beginning. Let's see the answer. After watching the video, we can simply say that the pain assessment form is a form that contains pieces of information about the patient pain. And the method used to assess pain was using the PQRST method: provocation and palliation, quality and quantity, region and radiation, severity scale, and time.
That's all we can say. Thank you for your attention. If you have questions regarding the focus of this presentation, please write in comment section below. Pain is temporary, quitting is forever by Lance Armstrong. See you soon. Bye.